in medical education, I feel knowingly or unknowingly, though it is not
Art
very
is-
obvious,
yes.
the art is
there. And
there.
art and science
You
is-
cannot separate it up.
Hello, Namaste. I'm Manisha Vedpathak and welcome to my channel, where we talk about art, healthcare, and space. If you have seen the other episodes of my channel of art in healthcare, and if you like the content, and if you're not subscribed, please do subscribe, like, and share, and do not forget to hit the bell icon to get the updates on my other videos. So today we have with us Dr. Deepali Jaju, who has come all the way from Oman, and thank you very much, Dr. Jaju, for giving us your time, and we are very delighted to have you here.
Thank you. It's my pleasure.
So to start with the conversation, my first question will be, since you are a doctor and you visit healthcare organizations as well as you you teach in the hospital. So I would like to ask, how do you connect with art? Whenever you see artworks in the hospital, how do you connect with it?
A very tricky question indeed. Because when person wants to see art, I think person will see art everywhere.
Yes.
But I feel art creates ambience, art creates that feel of welcoming, feel of relaxed. You feel more at ease in that place.
Yeah.
And when it is hospital, the patients are tense, the relatives are tense, they're not well. So there has to be atmosphere which will create that happiness, that positive vibes for the patient. So whenever I visit hospital, I do look at how the hospital is kept, the color of curtains, color of walls, how things like which is a predominating color, or are there any wall art?
Mm-hmm.
How are they kept?
Yes.
I feel these things do make an impact on patient recovery, how patient feels. So yeah, my attention goes there.
Great. So you also have that artistic mind, right?
Yeah, maybe you can say so.
Yes. So do you use art in your clinical practice?
My clinical practice. I am not treating physician,
Okay.
but I am in a department where we conduct various investigations for patients,
Mm-hmm.
like investigations for lungs, for heart, stress test, lung function test, like that. And for every such kind of test, I feel art is involved. I'll give you a small example.
Yes.
Say we are conducting stress test, and the
Right.
patient is walking on treadmill, he's holding on treadmill, he's a heart patient, and he's walking and walking, we make him walk. If he's walking looking at the blank wall, or if he's walking looking at a beautiful picture on the wall, will make a difference.
So I have read that art has been incorporated into the medical studies. I have read that on internet. But is that the case in India, as well as you are from Oman? So do you see that in Oman as well?
Your question is, art is incorporated in medical education?
Medical education to improve the visual skills of the doctors. I mean, the doctors who are studying.
In India,
Students.
I have not seen this in curriculum, that
Mhm.
doctors are specially given some sort of exposure to understand art or color or formations. But I would answer this from a different perspective.
Yes.
As a teacher, because I teach medical students, it is very essential that a teacher incorporates art while teaching. We need a lot of figures, we need a lot of graphs. Everything that is in the body, we cannot just put it as it is. So we need to make use of sketches or some cartoon characters, or we create what you call it 3D images, which will depict the functions in the body or structures in the body.
Right.
This definitely involves art.
Yes.
Also, we explain so many graphs, or there are pathology slides, microbiology slides where you are seeing all the cells and nuclei, structures, some tumors. Everything has a color, we stain with color.
Yes.
So, to understand all that, somewhere understanding of art is needed. And while explaining such things, if we use art, the complicated mechanics of the body can be made easy for students to understand.
Yes.
So this way, our teaching is not it's not possible without art. This is what I feel, and I myself would like to really incorporate art in my teaching. And also from the student side, the student who have got little art angle, if we ask them to present something, they also come up with very nice flow diagrams, or we create story out of it to present. So it is in medical education, I feel, knowingly or unknowingly, though it is not
Art
very
is-
obvious,
Yes.
the art is
Is there.
Is
And
there.
art and science
you cannot
is
separate it out.
interrelated,
Yes.
linked,
Yes.
I must say.
I don't think you need to have that kind of exposure or studies of art to understand medicine, but certainly it is involved everywhere.
And what are your thoughts on now? Since you are also painting, you have your painting maybe in your cabin or outside your cabin. What are your thoughts on how the art should be used in the hospital, where it should be used, or how the people should look at it?
Very interesting question, and this question takes my thoughts everywhere in the hospital.
Great.
Okay, so we can say it. It can be used as a great patient education tool. It can be used to create atmosphere. Maybe someone is in gynecology OPD or someone is in pediatric OPD. Then art form used there to make people comfortable will be very different. Or it could be small things. There are certain common diseases you want to explain, or common understanding that you want to tell patients. Could be simple, like don't smoke, exercise. For a pregnant lady, don't do this. Or you're coming for some heart investigation, say very simply that you need to exercise. So, or don't be fat, avoid junk food. All these things can be put through art very well. So, taking different sections of the hospital, in every section, right from OPD till investigation place or even operation theatre, I think everywhere art form will be required, and the type of art form required will be different.
Okay.
But I think it will be integral part of the whole hospital. Also, I feel hospital also has to project what are their goals and objectives. They may have central theme, like some hospital will have central theme like we work towards mother and baby health.
Right.
Yeah. So if they want to show that, they will have to use some kind of art form to show that this is how we help society or help patients. So instead of just writing,
Exactly,
please
instead
take care of mother and baby, it's
Yes.
better to show through some
Yes.
art. So there are many things in the hospital where art is involved. Even in simple signs, like
Any
a
diagram.
photograph is not allowed. Instead of just showing camera and a red slash,
Yes.
you can show some baby cartoon that no,
Yeah.
photograph not allowed. It depends, but it can be used, and it could be more appealing.
So people are more interested into visuals actually. Now I would like to ask you, I had seen one of your paintings on your phone, and I would like you to explain us about what you have drawn and why you have drawn that.
You're talking about the lungs?
Painting, yes.
Okay, so our thought was, I wanted to show normal lungs, how do they look like, and I wanted to show how lungs look like after smoking or after hookah or shisha smoking, not only the cigarette smoking. So I used lungs realistically, and on one side of the lungs I used sandwork oil. This is all oil on canvas, so I used sandwork, and then on the other side sandwork plus the charcoal incorporated to show how charcoal gets incorporated in the lungs. And I actually showed burnt cigarette and hookah
Yeah,
to show
that was very interesting, I must say.
Yeah, thank you so much.
Yeah.
And then I wrote there, your lungs are not ashtrays.
Yes.
And I wrote the same in also Arabic because it's local cultural language.
Okay.
And when people pass by, they see painting, they show their children, see what happens if you smoke.
Exactly.
It's very indirect education. I feel it's more impactful saying that, hey, don't smoke, this is not good.
Yes.
When they see actually what happens to lungs, this is what you can show with picture, not with words.
Right. So again, visuals are very, very, very important.
I totally agree.
Yeah.
Visuals are required.
So you say that you have used all this. So your painting is actually a mixed media,
Yes.
I must say.
Yes.
So have you learned art before?
In school days, yes, I have learned a little bit of art. You have those elementary, intermediate exams, but there was interest towards art, so kept experimenting. I'm not a great artist at all. I like, that's all, and I make an attempt.
Okay.
That's it, very little attempt.
Yes. So, and I would like to ask that how patients are getting benefits from the artworks. I believe that even the staff working there, like nurses, doctors, they also benefit from the artworks or from the environment that is created by those artworks. So, what are your thoughts on it?
See, Manisha, when you enter hospital, whether you enter intensive care unit, accident and emergency department, or you go to any ward, the usual picture is on beds there are patients.
Yes.
There are too many equipments. Every equipment is doing something else to the patient, and every equipment has its own sound. Beep 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 beep. Queen. You know, this is very not healthy, not happy. It's very scary at times. So to cut this and also to help that patients scare a little bit, to make them relax, some art form is required. Patients are lying down there, they are sick, but the nurses, doctors, ward boys, they are all working there.
Right.
If they keep seeing this dry environment full of tension, it's not very nice. When the work is done, when your duty is done, you may feel exhausted.
Yes.
But if you incorporate things, you can't change things. The patient who is sick, he's sick.
Exactly.
You have to treat and you have to wait till he's fine. But you can aid his recovery if you use some other media.
Right.
There are hospitals where they can put some small sound, peaceful music.
Right.
Right? Art form has got equal importance. If you see some nice colors, little happiness, some warm colors, some painting, some motivating nature-related paintings, nice fresh flowers, don't you think the patient will feel nice?
Very
Is
true.
he just going to look at the plain wall thinking I'm sick when I'm going to die?
Yeah.
That's very extreme situation. But this does happen. This is common scenario in the hospital.
Yeah.
So instead if you put something,
right,
I think it will help patients.
Right. We actually, when we interviewed Dr. Sangeeta Mahajan, you know her, right?
Yes.
So that time she gave us a point that the artwork can be done by the nurses actually, because there are some artistic people, so it can be done by themselves, or the artwork can be, it can be painted by their children and they can put it on the wall. And that is going to motivate them,
Not only that, Manisha, but artwork can also be done by patients.
Yes, of course.
And we get patients, they come with, as a mark of respect, as a mark of love that doctor has done. They come up with paintings.
Right.
And if doctor is not able to understand what patient has drawn, you need to be a little sensitive towards what patient has done. So we do put up paintings which are done by patients in the ward.
That's great.
And it is motivating for other people that in spite someone is sick, someone is putting efforts.
Yeah.
So seeing art, doing art, it's a feel-good factor.
And as I got this point from you that the artwork has to be appreciated by doctors as well.
I
the gift, so. The artwork which is created by the patient, doctor should be able to analyze that painting. He should be able to read that painting. That's such a good point to remember.
Yes, thank you.
And normally, according to you, where should the artworks be in a hospital or in any healthcare organization normally? Where should the artworks be? Like, for example, reception area. Where else artwork can go?
Artwork can be everywhere in the hospital, whether it is ward, investigation place, reception, or wherever. So, what is suitable for that place? There should be an artwork. So, I can give some examples.
Yeah, sure.
Like in reception, we put up a artwork of snake and ladder.
Okay.
And we created snake and ladder, our routine game.
Yes, yes.
So we put up like, if you eat burger, then you are at the snake mouth, and then your heart health will go down.
Oh, great.
Simple
illustrative.
very illustrative
yeah.
thing. So this was in the reception.
Uh-huh.
But if you come to say lung function lab, then we have artwork which is related to lungs. That what has happened to your lungs.
Right.
If your whatever your disease is, what does that disease mean to you? Is shown in the picture.
Okay.
So patient understand, I have this.
Right.
Okay. Or sometimes when we want to explain patient to do something, we also make use of artwork. There is something like visual analog score. We ask patient to say that my symptoms are, how severe are my symptoms?
Okay.
Is 0 to 10. 0 is no symptoms, 10 is very severe.
Okay.
So instead of just writing one line and 10 marks, we can also put the picture of severity.
Okay.
That this is mild and this is severe. So this is patient related here. But in another way, artwork also could be something on the wall, or curtains could be colorful.
Right.
Yeah. Or patient dresses, what the color is used there.
Yes.
So instead of just those plain blue, plain green curtains, there could be little design of flowers.
True.
That will also add to ambience.
Yeah. So according to you, the artwork has to be specific to the to different departments. I must say, like pediatric
Yes.
department will have cartoons,
Yes.
and reception area will have something more serious artwork, something like that.
Yeah, something related to that, so that you are doing patient education, you are informing patient.
Yes.
It is also hiding time for patient till they are sitting there.
Yes, waiting area.
They look at it, so it is different. It should be different.
Yes, and normally when you have seen these artworks in the hospitals, what is the style of the artwork, or I must say, what is the theme that is used normally in the artworks? The ones which you have noticed.
Interesting question. I think majority of the times it is nature.
Nature.
Showing happy part of the nature.
Okay.
Or sunrise.
Mm-hmm.
Sea waves.
Okay.
So it's again inspired by nature.
Yes.
Or it could be scenic painting of mountains and hut, and some people are working in the farm. But again, it's coming from nature.
Nature, yeah.
Sometimes it is abstract.
Okay.
But I think maximally I have seen the nature inspired.
Nature has the healing power, actually. In your view, art does make a difference in healing the patients.
I do. I feel that. It makes a difference. It aids.
It aids, yeah. It speeds up their recovery.
Yes.
Yeah. And I think with this speeding up, it is correlated that the hospital stay also will be shortened. When the patients,
I don't know if there are
patients,
actual scientific studies, but
there
hospital stay shortening is very hard to say, because it all depends on disease. How severe is the
It does
disease and
depend
what
on
is the
disease,
patient.
but
it can definitely help.
Yes, because studies have shown, actually, I have read about that scientific studies have shown that patients whose walls have some type of artwork, nature artwork or abstract something, it has distracted their mind from the pain which they are suffering from, and it has also helped them speed up the recovery, and because the recovery is speeded up, the hospital stay is shortened. That is what
Interesting. That
that is
nice.
what I have read.
It's nice.
Yeah.
hospital stays shorter means patient is recovering faster. Which is
That's right. Very nice. Now, coming to my last question. What we are doing this creating videos is to create an awareness of the benefits of artworks in the hospitals. What do you have to say about it?
benefit of artwork in the hospital.
Yeah. I mean, what do you have to say about this awareness, about our efforts to create this awareness?
Oh, excellent awareness. Because a hospital is not just meant for sickness. Hospital is meant for recovery. Hospital is
Exactly.
meant for becoming better. And if art is involved, I feel it will aid not only patients but also doctors, nurses, hospital staff,
Yes.
and everyone. You have a very great initiative, Manisha, that
Thank
art
you.
involved in hospital, and I really wish you great luck. And please spread this message.
Yes.
Art is required.
Very true.
The colors are needed. The art is needed.
Very true. Thank you so much.
Thank you, Manisha.
Yes. So, guys, today's episode was definitely very interesting, and I must say, my take from this conversation was that the artwork in the hospitals should be interactive. So, thank you very much. And if you have liked this video, do subscribe, like, and share. And see you in the next episode with yet another healthcare professional. Thank you so much, Doctor.
Thank you, Manisha. Thank you.